All right, family. God bless you. It's the time you've been waiting for. Senior Talk with Clara Hubbard, your resource and information show for people getting better with age. Well, let me tell you, it is the month of October. Yes, we are going pink for breast cancer, but one of the also impactful and most um, informative times of the year is coming around. That's called AEP. What does AEP means? Well, this smiling young lady here from Zing Health, one of our phenomenal sponsors, is going to tell you about it, get you some education. But also, I want you to do one thing in advance, and that is tell your friends that Senior Talk is live. We'll be right back after this opening. Everyone, stay tuned. All right, family. As mentioned, welcome back to Senior Talk with Clara Hubbard. Another episode. We are here today. Let me tell you, Zing Health, they have not taken a break since the beginning of the year. Last time we were together, we were in what we would call the height, if you would say, of COVID 19. Now we're seeing a little relief, but let me tell everyone, COVID still exists. But we're taking the avenues of making sure that you're protected and secure. So I'm telling you, everyone, please listen. We always hear about all these commercials. You got famous people talking about Medicare, Medicaid, and all that good stuff. But we have an expert with us today. She is Sadia Selvey. She is Vice President of Sales and Marketing. She is a busy, busy, busy lady, but she's also a friend of Senior Talk. And we're telling you to invite everyone to get this information. Of course, this broadcast will play in several places where you can find us. And I will always say you go to clarahubbard.org to find out more. So welcome, welcome, welcome. How are you this beautiful day?
I am wonderful, Clara. Thank you so much for inviting us. We're always excited to be a part of Senior Talk
Oh,
with Clara Hubbard. It's such a wonderful avenue for seniors to learn and just be informed about what's going on today, and whether it be the healthcare field or just in our backyard or our neighborhood. So thank you so much for the service and the work that you're doing.
oh, my pleasure, my pleasure. Well, it takes good people, and I tell you, I take this seriously. So I only work with the best, and so Zing Health is definitely right up there with me. So let's talk about it. When we kicked this off last year, October, we were in the better stages of COVID, as we would say, where we were learning about the vaccinations and so forth. How did Zing successfully stay in business through this process? What was the strategy that you all took to still keep your clients, your patients, and your staff secure and well?
Well, as they say, the ear to the ground. We were very just our ears were to the phones basically,
Hmm.
because we were always interested in understanding what our members were going through, ensuring that they had the services that they need during COVID. We even implemented some benefits as a result of COVID to help address some of the things that we saw initially when COVID started. And so, one of the things that we did, we listened. That
Hmm.
was probably one of the most important things that we could have done at a time that we had not encountered before. So
Yes.
it's very important for Zing to listen to our members, to hear what they were saying, and to understand the brevity of what some of our members were going through. And as a result of that, we were able to design some of our benefits to ensure that our members had access to important things like groceries. You
Mm.
know, we saw social isolation, during the pandemic, and so we were able to design our plans and bring about really unique benefits that address some of the social determinants of health that we saw during the pandemic, like social isolation, food insecurity. We even brought all of our insulins down to zero cost share because economically, it was a strain for some of our members to afford insulin. And
Yes.
so, our goal is access. We're always thinking about how our members can access the benefits. And if someone does not have a copay or they can't afford their insulin when they fall into the coverage gap, that's an issue and that impacts healthcare outcomes. And so one of the things that we did when we looked at that is we put all of our insulins on tier one, which is zero cost share, not only initially, but also during the coverage gap. So this helps individuals who don't necessarily qualify for Medicaid or extra help. These individuals would still be able to get that assistance and get that help on any Zing health plan that we offer.
Wow, that is tremendous. And we have to make mention too that one of the things that we did, and I mention this as often as possible, is that through the COVID process, we had to realize that we also had our disparities were still in place. So we had to still work on our better quality of care.
Yes,
Vaccine, no vaccine, all that stuff. But then there's diabetes and cancer and Alzheimer's, dementia, all those things still we're in still going on. And some of us kind of held back on
yes,
taking care of our well-being because we just wanted to find out what was happening to our country and how do we stay safe. So I congratulate you. And that's a big to do. So now that we're moving a little bit more into a new normal,
yes.
what is the new phase of going on with Zing? You've been everywhere. We've been to the veterans party. We've been to the step set. We've been to food pantries. We're standing outside of restaurants and many places. You're just visible, participating in a lot of great things across the city. You were also at the African Festival of the Arts this year, Black Women's Expo. I mean, you did it all. So what else can we expect? Where are we going? What is the phase now that we're going to this last quarter of 2022?
Yes. So right now, our primary focus is the annual enrollment period.
Mm-hmm.
This is a time when Medicare encourages Medicare beneficiaries to really review their benefits for the upcoming year to ensure that if healthcare needs have changed for individuals who are on Medicare to evaluate those things to ensure that they have the proper coverage going into the new year. And so our primary goal and focus right now is we're out at events, we're securing partnerships, we're out there in the community with different organizations, just promoting education.
Mm-hmm.
Sure that not only seniors but people with disabilities or Lou Gehrig's disease or end-stage renal disease have the proper information so that they can make informed decisions about what they can do right now. Because right now, people can actually enroll into a Medicare Advantage plan. They can pick up prescription drug coverage. They can change their plan. They can basically do what they need to do during the annual enrollment period. And it's important because it's going to impact your coverage for the remainder of next year,
Mm-hmm.
for the beginning and the remainder of next year, which is why it's so important for everyone to just stop and review their benefits and make sure they have adequate coverage for 2023.
Absolutely. So, what I would like for you to do, because when we talk about Medicare, um, people become like, oh my God, it's a maze. How do I start? Where do I begin? There's so many letters. Does that letter apply to me? All that stuff. So, we're going to navigate just a little bit.
Yes,
Let's talk about the business of itself of Medicare, who
yes.
qualifies, and those things.
Yes, absolutely. So there's a myth where people believe only seniors qualify for Medicare, but that's not true. There's actually four classes of individuals that qualify for Medicare. So
Hmm.
you have those 65 and over who have earned Medicare by right of working at least 10 years or 40 quarters. You have those who are under 65 with the Social Security or Railroad Retirement Disability. They may qualify for Medicare after being disabled or deemed disabled for 24 months. And in that 25th month, they're eligible for Medicare. Individuals who have end-stage renal disease, who are on dialysis, they're eligible for Medicare. And then people with Lou Gehrig's disease or ALS,
All
those are
right.
four categories.
Yes, yes. So let's do this. I'm going to play a quick commercial because I want everybody to see the fun things that you do at Zing Health because Zing Health is turning 25. We'll be right back after this message.
Zing Health is turning Zing Health is turning 65 and dancing the night away. Zing is getting your extra steps in. Zing is your trusted partner helping you navigate the Medicare maze. At Zing Health, we listen patiently to your health needs, personally guide you to the best Medicare Advantage plan, help you maximize your benefits so you can start optimizing your health today. Are you turning 65? Amazing starts here. Explore how Zing's Medicare Advantage plans help you feel amazing. Call 844-ZING for us or go to myzinghealth.tv.
All right, so Zing Health, y'all look good for 65. I tell you, you look real good for 65. I tell you. So, why do we get confused for saying? How do we get confused? How do we get scared? And why do we become so intimidated by asking questions,
I'm not sure, but the one things that I teach our Medicare agents who are licensed by the state to provide these services is education is key. Once a person is informed about their options, then they're able to make an educated decision about what their needs are. And so, here at Zing Health with our licensed Medicare advisors, we're really trying to understand that individual's needs in order to help them to make a decision about, what their plan should be in terms of Medicare Advantage, or do they need to go on a chronic special needs plan, those types of things. And I think it's really important. Did my screen go away?
No. I just made you to focus for a minute. You all right? You're fine.
Yeah, so education is key. And that's why we spend a lot of time out in our communities building those partnerships. We currently have over 200 events per month.
What?
Where we're out partnering with, our community partners to help educate, residents in our service area about Medicare, about Medicare Advantage, about Zing Health, about what's available to Medicare beneficiaries as a result of them earning these benefits. These are individuals who have earned benefits. No one gave them these benefits. They earned these benefits. And so a lot of times, one of the things that I hear that's said a lot, because anytime you associate a zero premium with a plan, people think maybe that's not as good. But when you talk about Medicare Advantage, here's what most people need to understand in terms of Medicare Advantage. While you were working, you were paying into Medicare. They were deducting Medicare out of your checks via taxes. When you stop working and you receive Medicare, you pay a Part B premium. Now, currently, that Part B premium is $160 plus in terms of that monthly premium. So you're still paying into Medicare. How Medicare Advantage is funded is it takes the money that you were working, takes part of the money that you paid into Medicare while you were working, and that Part B premium goes to fund Part C. So it's not that it's free, it's that you've paid into it and you've earned these benefits by right of paying into Medicare.
Well, you say it again, you've earned the right, you've worked to have this benefit.
Yes.
Isn't that something? And some of us are so intimidated. But let me do this. I know if you could, and I'm springing this on you, but I need to include a number for those who are listening and tuning in. So if you could just update me with a phone number, I'll be glad to add that as well, because I'm telling people you don't want to miss it. And what's great about this, and I want everyone to hear me clearly, is that Zing Health, if they don't have a benefit for you, don't be intimidated. They'll work with you. You're not that type of people where you're so selfish that you can't identify the benefit factor for yourself. So they are nice people. So what's the phone number that you can give me right quick?
1-866 946 4458. That number again is 1-866 948 4458.
All right. 458. Did I do it right? We're going to get it. Well, let's do this. Let's show us in the community because we do it so well. Everyone say, too, this is an event we did at a veterans post. We come anywhere. Presentations are what we specialize in, and we do it well. And we even had the man himself, our good friend, CEO, Dr. Eric Whitaker, with it at that time. Everyone stay tuned. You're going to enjoy this. We'll be right back after this message. all right, everyone. So let me tell you, that is with us. We were at the Veterans Post, Giles Post, 1987, where we were invited by Commander Frank Thompson. And we love you, Commander. I'll tell you, and we're going to be coming back shortly. We're going to be coming back shortly. So let me tell you this: what are the preparations? Because some people say, I'm here and I'm listening, but I just, kind of figure things out. What would you tell someone?
You have a limited amount of time to figure things out, and you don't necessarily have to navigate that maze by yourself. We have licensed Medicare advisors who will assist in helping you to understand, number one, Medicare, what you need in terms of your Medicare benefits, in addition to just Medicare A and B, because Medicare does require Medicare beneficiaries, when they become eligible for Medicare, to also enroll into a Part D, or a prescription drug plan. And so we can show individuals how to do that without spending additional money to get things like Part D and additional coverage for services like vision, dental, hearing, prescription coverage at no additional cost, because these things could potentially cost an extra premium. And in most cases, especially if you're on a fixed income, you want to try to avoid that, because Medicare Advantage is just that. It's an advantage over Medicare. And here's why I say it's an advantage over Medicare. If you have original Medicare, you have coverage for hospital and your outpatient doctor visits. That's what Medicare Part A and Part B covers. When you add Part C, you're also adding, in most cases, or especially with the Zing Health Plan, a prescription drug plan, dental coverage, vision, hearing, a health club membership, zero cost share for insulin, a OTC benefit. There are so many additional benefits that you would add to your Medicare without any additional premium. Because remember, you're already paying into Medicare through your Part B premium, whether you pay it directly or if someone else, like the state, is paying it for you. And so Medicare Advantage does give you that advantage over Medicare, because it also limits your out-of-pocket cost share, which original Medicare does not do. And
Right,
so
right, right.
that's a big factor in why Medicare Advantage.
So, what are the testimonies that you can share? Because, I mean, we've been multiple places, and some of us sit as ambassadors on behalf of Zing Health, and it's a pleasure to do so because you got everything locked in. So, what can you share as testimonies that you can say your clients have shared? Because, as you mentioned, you have done it so successfully, and you always think about them first, which is
Yeah.
priority. And let me just say this too. I'm all over the place, but what a team you have.
Yeah.
I have had the best experience whenever I am present and Zing Health is with me, whether it's a new face or not. I am so confirmed that I am in the right place at the right time. They're knowledgeable, they're patient. And that's what a lot of friends people say, because sometimes we all know we're looking for a particular range of, let's say, um, I wouldn't say we're not number based, but we're education based. And you
Yes.
can kind of tell and feel that sometimes when you're in the community. Some people just trying to get numbers, but have you educated me? Have I learned anything from you? Is this the right fit? And so that you offer, the plan where you can say, just call our number or visit our website and let's navigate what's best for you. And I think that is premier. I can cheerlead for you right here. These are pom-poms right here in my hand. So how do you do that so well?
Yeah, so one of the things that we do is we sit down with each individual Medicare beneficiary. We give them our undivided attention. A licensed Medicare advisor will either come out to the home or talk to you over the phone about what your needs are. And so, number one, we listen to what your needs are. And hey, if it's not Zing Health, we'll point you in the direction that you might need to go in. But one of the things here at Zing Health that we are strongly and keen on is providing access, ensuring that our members have access to the benefits that are covered under Zing Health. And I'll give you an example.
Okay.
We talked about testimonies. One of the things that fueled my passion early on in my years of experience with Medicare was a gentleman that I came across who, when I walked into his home, he had boxes everywhere. So I said, "Oh, you're moving,"
Mhm.
and he said, "Well, actually, I had a stroke and I was in the hospital for over 3 months, and the hospital is now putting a lien against my home. He said, "Where were you over 3 months ago?"
Oh,
Because
wow.
one of the things that people don't understand, and this is part of Medicare education, there's no stop loss with Medicare.
Wow. Wow.
Hospitalization or utilizing your Part B benefits. One of the biggest advantages to me with Medicare Advantage is that you have a maximum out of pocket associated with your plan, meaning if you go, you will not go over a certain dollar amount. And if you do, all of your services are covered at 100%. And let me tell you why that's important. The maximum out of pocket for our plans is like $4,500. That's the max you would pay in any given year. And let me tell you why that's important. If someone had a skilled nursing facility benefit, let's say they broke a hip and needed physical therapy,
Hmm.
and they had to be in skilled nursing for the full 100 days, that's over $11,000 out of pocket to a Medicare beneficiary that they would have to pay for their care.
Out of pocket?
Out of pocket, that would be their
Wow.
pocket. We're
Wow.
not, we're not talking about the hospitalization because there's a deductible that goes with that over $1,400. And so when you start to add all of those things up, when you think about Medicare Advantage and how it limits that out of pocket cost share,
Hmm.
and if you ever hit that maximum out of pocket, let's say $4,500, you're going to be covered at 100% for your Medicare Part A and B services.
Hmm.
So that's one of the greater advantages that you don't necessarily hear about, but it's
Yes.
one of the most important ones for Medicare Advantage outside of some of the supplemental benefits you receive.
Absolutely. So what we're going to do is we're going to ask people to do this. Go to myzinghealth.com is the website. And I will definitely, when we post this broadcast out, we will definitely include it. We're going to be on Amazon, iHeart, and also on Spotify. This podcast will be available on tomorrow. Please remember the dates, however, start on October the 15th through December 7th. So she's our beautiful co-host is looking real calm now. But let me tell you, in the weeks to come, we're going to be on roller skates. But we do offer this. If you have a church ministry, if you have a block club meeting, if you have a red hat, pink hat, wherever you are, we will come. Like I said, we've been to stepper sets, we've been to festivals, you name it. And there's more to come through these holidays, upcoming times. So if you are very interested, definitely do me a favor. How about this? I can get you in touch with them. You can go to clarahubbard.org or call our office at 312-428-6919. Now,
And
what is
our
it?
number,
Pardon me, go ahead.
I was just going to say, and our number is 1-866-946-4458. 1-866-946-4458. We can definitely send a Medicare, licensed Medicare advisor out to speak with you for a annual enrollment period so that
Mhm.
you can review your benefits, understand your options, and make an informed decision.
Absolutely. And now is the time. So let me ask you this. For those who have questions, what are the documents we need to have in place or how does the process work? October 15th, I'm calling Zing Health, got the number. What do I need to be having with me to make our call in time more impactful?
So one of the things that you definitely want to have is your Medicare ID number,
Hmm.
your Medicare, or they call it an MBI number. You also want to have the medications that you're currently taking, either a list of the medications or the bottles present during any, engagement with an agent. You also want to have any other information that's important, like your doctor information. If you currently have a plan and you want to compare how a Zing plan compares to your current plan, that's the type of information that you can have as the beneficiary to be more engaged with that appointment.
Wow. Well, I'm excited because we got room. I know you have, I just, well, like I said, I always call you because we talk quite often, and I always just commend you on the team that you have in place. It's very important because those persons represent the company, whether they're with you or without you in a setting. And so that's key, 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 key. So for those who are sitting around thinking, well, I don't know, the Medicare maze can be defined for you. It's also available to you through Senior Talk Media. We'll put you in touch. I'm going to get the correct number because I'm writing it down and I can't read my handwriting. I'm crazy. But we'll get that correct for all of our posting and listening. I appreciate all the seniors who are responding through Facebook. We also are on LinkedIn and we're on Twitter. So we covered every angle. We're not missing anything. But now is the time. There are so many commercials. There are so many commercials. What does that mean? We saw Jimmy Walker. We saw Joe Namath. We saw somebody else. It's everybody. But we're talking about Zing Health. We're going to take care of it for you right here. So let's get someone live that you can respond to, who will respond to you. Let's make a personal connection. And please, when you call the number, when you see them, tell them you heard it and saw it here on Senior Talk with Claire Hubbard. So we're closing out our program. It's always fun to be with you. I know you're so calm, but I know when the 15 hits, all hands on deck, as they say, all hands on deck.
Definitely all hands on deck. And just want to add this because one of our newer plans for 2023 is part of that reduction of the Part B premium. So we have plans that will reduce your Part B premium as well, because we saw one of the biggest hikes in premium increases for Medicare beneficiaries when it went to $170. Medicare has since for 2023 decreased that premium amount by about $7, but still we have plans that are geared toward decreasing that Part B premium even further. So you want to make sure that you understand how these plans work, because you really want to be educated about how some of these plans work and be careful about the ones you select, because some may not have prescription drug coverage, which most Medicare beneficiaries need prescription drug coverage.
Right.
This is why it's really important to sit down with a licensed Medicare advisor, and so that we can help you understand what your options are. And again, that number is 1-866-946-4458. If you want to schedule an appointment or if you want more information, we're here to assist.
Absolutely. So everyone, we're not going to take up too much more of your time. We thank you for choosing us today to be a part of your day through Senior Talk with Claire Hubbard and our co-host and always returning sponsor, who bad. They just bad. I just love them. See, let me say, we're now in some more additional states. We're also covering Indiana.
Yes, well, we were in Indiana last year, but yes, we have new Medicare licensed advisors in Indiana as well. So they're available to come out as well, and in Michigan as well. But we're in 11 counties here in Illinois as well, which includes the Rockford area, Cook County, Will County, Kane, Kankakee, DeKalb, DuPage, 11 counties here. Three in Indiana, which include Allen, Lake, and Marion, and then in Michigan, that's the Detroit area, which is Wayne County, Oakland, and Genesee counties.
All right, we got some listeners and viewers in Wayne County. Hey, Detroit, we love you. So we got more work to do. So I got to get on my outreach. Let me tell you, I got to get on my outreach. So everyone, we just want to say thank you for making us a part of your day. As mentioned, our co-host today was Sadia Selvey, Vice President of Sales and Marketing, boots on the ground, starting October 15th and year round. Let me just say that year round. It's not just this time, but open enrollment period begins October 15th. Please, if you have any questions, don't go through this maze alone. Talk to a licensed expert at no cost to you. How about that? We can make it happen. So we appreciate you. You got a closing remark? You just got about 30 seconds to share what you want with our listening audience today.
Absolutely. Well, I just want to say thank you for allowing us to share this information, because our goal is education.
Yes.
The key is access. And we are dead set on ensuring that we have health equity represented in our communities, in diverse communities, and so that's really important. It's part of our mission, and we're here to help. And we want everyone who has Medicare to ensure that they have access and health equity. So that's our biggest challenge right now.
Education, access, and health equity. She said it all. God bless you all. Thank you for making us a part of your day once again. For more information on details about our programming, go to clairehubbard.org. Make it a great day. And as I say in closing, in complete darkness, we are all the same. It is only our knowledge and wisdom that separate us. Don't let your eyes deceive you. We'll see you next time. God bless and take care.